Obviously, when a doctor makes a significant purchase for a laser, they want to feel comfortable that if there's a problem, they can pick up the phone and talk to a real person. And I've had nothing but great experience with Iridex. First of all, I've got to be honest with you, I've really never had a problem. I don't know if there's any moving parts in this laser. It's a solid state laser. It's it's the size of a VCR. The only problems I've ever had were if I damaged a handpiece. But if I ever had a question, whether the machine, the settings, I can pick up the phone and I can call somebody and they'll always answer that question, and they will, you can go through Iridex, they'll put you in touch to the technical people. The reps are great. They'll come out and, like most doctors, we all have a relative turnover where every couple of years you have staff coming and going, and they'll come out and do trainings for my staff. I've had very little problems with this laser. I think it's just solid state and it's reliable. But if you need somebody, they're a phone call away. And I haven't seen that with all laser companies. Unfortunately, again, in this field, you got companies buying and selling companies, and so this has been stable on my radar for 12 years.
The combination of the 532 nanometer wavelength and 1064 built into the same Gemini system is very helpful because you can use the 532 nanometer green wavelength to treat superficial red lesions in fair skin as well as brown dyschromias, and you can, with a quick switch of the panel, go to 1064 nanometers to treat larger blood vessels in darker skin patients or hair removal.
One thing I like about the Gemini, which I think is a little underreported, is flexibility in terms of treating different skin types. I mean, you think about these lasers in this wavelength and you think about being on lighter skin tones, but in fact, a 1064 obviously can work very well on darker skin, but 532, when used properly, can also work in darker skin for treating epidermal lesions. And so in our patient population, which is a mix of Caucasian, some African American, and some Hispanic in our town of Charlotte, we get the opportunity to use this for epidermal lesions all the time in African American patients, and I think it works really well. If you know there's proper settings and proper technique, it's really a go-to device for treating certain epidermal skin lesions. I think what's one hidden gem that I'd like to tell people that this wavelength is really very, very flexible.
The Gemini is a great laser because of its versatility. The 532 nanometer wavelength is well absorbed by both pigment and blood vessels, and so it could be used for a wide variety of indications. Some of the indications that I treat using Gemini include treatment of rosacea-associated erythema, telangiectasia associated with rosacea or telangiectasia for any reason, superficial pink leg veins, poikiloderma of Savant. We can also treat pigmented lesions using the Gemini laser because pigment is absorbed by the green light, and it works well on photodamage associated dyschromia as well as melasma in some cases.
One of the great things about being in the laser field is there are new lasers that come out every day. It makes it a very exciting arena to be in. The problem is the popular machine of today, unfortunately, often becomes the machine that you don't need a year from now. The VariLite is tried and true. The wavelengths, 532 nanometers, 940 nanometers, they work. We've had the machine for several years. It doesn't break down. Patients send their friends. It's a great machine to have in the office.
The VariLite is my go-to device. It is a device that I've been using now for years. I can't think the last time it was maintained, to be honest with you. It never seems to go wrong. I generally am treating facial telangiectasias, maybe some lentiginous, mainly on the face, sometimes on the back of the hands as well. But it's such a simple device to use. I mean, it's briefcase size. You can move it around from room to room. If you've got a clinic in another town or something, you can simply put it in the back of your car. I mean, it's incredibly versatile. And to be honest, I can't think of running a clinic without one.
Another great innovation with this laser is the clear view polarizing headlight system. And I'll tell you why this has become very important in my practice. Number one, it's illumination. So if you can see better, you're going to treat better. Number two, it's magnification. But the biggest advantage of that, well, the two biggest advantages are, number one, just by focusing the ring, you can take the reflection off the skin and have the illusion of seeing through the skin. So I can treat vessels that I wouldn't ordinarily treat. But the biggest advantage is that it's clear and it has built-in 532 and 940 safety protection. Otherwise, you're wearing amber goggles, and unfortunately, that obscures a lot of the field that you're treating. And so, by having illumination, magnification, and clear safety protection, I can do a much better job. And that has been a really nice innovation to have.
The VariLite has been a tremendous boon to my practice, and primarily because patients are so happy with the results. Apart from any marketing that you can do, there is no greater marketing than having a patient immensely satisfied, telling their friends and their friends and that friend and that friend. And it's very, very calming for a patient to know that they are not going to be walking out of a treatment all black and blue or anything, and that they are capable of going out to dinner the very, very same evening because the facial spider veins are erased on contact. That little pinkness after treatment will already be going away in just a 20-minute time period. They're free to utilize makeup. Many go right back to work and immediately show off their friends or show the treatment off to their friends because they're gone, because they're typically instantaneously gone.